Are you aware that your skin can be an indicator of your health? Diabetes affects millions, and it's not always easy to spot. From dark patches to blisters, the warning signs can be subtle. But what if we told you that your skin could be the first line of defense in identifying this chronic illness? In this video, we'll cover the warning signs of diabetes that may appear on your skin and what you can do about it. So it's time to pay attention to your skin. It might be trying to tell you something. First up, skin signs of diabetic dermopathy, or DD. This common skin condition is also known as diabetic shin spots. These spots look like small, dull, red or brown scaly patches on the skin, typically on the legs, and can occur in up to half of those with diabetes. Usually after around 18 to 24 months, these lesions disappear, leaving behind a depression in the skin and increased pigmentation. These conditions are more common in men and seniors, and are often associated with other diabetes-related health problems, such as nerve damage, kidney disease, and heart disease. One theory suggests that DD is caused by damaged, tiny blood vessels in the skin which become pigmented due to the accumulation of hemosiderin, a byproduct of hemoglobin that breaks down melanin, the color pigment in the skin. Another theory is that DOD is caused by nerve damage in the skin, leading to a loss of sensation and minor injuries to the skin that often go unnoticed. This benign condition often goes away on its own. However, it is essential to manage diabetes and its complications, as DD may be a sign of a more serious underlying health problem. There is no specific treatment for DOD, and available treatments such as topical corticosteroids or laser therapy are also not very effective. Next is bullosis diabeticorum, or BD. This rare condition affects around 1% of the U.S. population. It causes sudden, firm, and painless blisters on the skin, typically on the hands and feet. These blisters can range in size and appear simultaneously on the right and left sides of the body. It is more common in men and those with type 1 diabetes. You can develop this condition if you're above 50 or have had diabetes for a long time. But again, this is not a rule of thumb. It might be related to changes in the blood vessels or an autoimmune process. Exposure to UV light, variations in blood sugar levels, nerve damage, or other factors might be involved as well. If you develop BD, ensure to protect the affected skin and monitor for signs of infection. Infection of these blisters can cause further complications. Avoid using topical antibiotics unless there is an indication of a secondary infection. Have you ever heard of acanthosis nigricans? Unlike other skin conditions, this condition is quite common. You'll see dark, thickened patches on the skin that have a velvety or warty texture. The patches typically appear on the neck, underarms, elbows, and groin. If you have other conditions associated with insulin resistance, such as obesity, polycystic ovarian syndrome, and thyroid dysfunction, you can develop acanthosis-specific receptors on the skin cells, increasing cell growth and thickening of the skin. If you see these skin changes, mutations such as metformin that improve insulin sensitivity and blood sugar control can help. Moving on, let's talk about eruptive exanthemas. This condition is associated with high levels of triglycerides in the blood, particularly in those with diabetes. You can identify its development by clusters of tiny pink or yellow pimples suddenly appearing on the skin. These bumps typically appear on the buttocks, hands, legs, and other areas prone to injury. These bumps can be tender or itchy, but are usually painless. Eruptive exanthemas happen due to changes in how the body processes fats in the blood. If you have diabetes, the body's ability to process fats is often impaired, leading to a buildup of triglycerides in the blood. This buildup can cause fatty cells in the skin. They become overfilled and form the bumps seen in this condition. Treatment for eruptive xanthomas typically involves addressing any underlying conditions contributing to the high levels of triglycerides. Medications such as fibrates or omega-3 fatty acids may help lower triglycerides. Next up is diabetic foot syndrome. This condition affects feet due to various factors, including nerve damage, poor blood flow, and impaired wound healing. 1 to 4% of those with diabetes will experience diabetic foot syndrome, and it's slightly more common in those with type 1 diabetes. Diabetic foot syndrome usually starts with dry, itchy skin and calluses caused by diabetic neuropathy. As the condition progresses, it can lead to chronic ulcers, which are more likely to occur in areas of the foot or other sites prone to trauma. Nerve damage, poor blood flow, or combination of both cause them. Any secondary infections can complicate the healing process, prolonging it. Another complication of diabetic foot syndrome is diabetic neuroosteoarthropathy, also known as Charcot's foot. It's a debilitating and deforming condition that affects the weight-bearing bones and joints of the foot. It can cause the midfoot to collapse, resulting in clawing deformities of the toes. Also, be mindful of redness, warmth, and a burning sensation in the feet. This is called erythromelalgia. The best way to prevent and treat diabetic foot syndrome is to manage your surge-specific diabetes, control your blood sugar levels, and take care of your feet by keeping them clean and dry and wearing comfortable shoes that fit well. It's also important to see your healthcare provider regularly and seek treatment immediately if you notice any changes in your feet. The following condition is generalized granuloma annulare, or GIGA. This rash affects 10–15% of those with diabetes. It starts with small, skin-colored or reddish bumps on your skin, and over time, these bumps form a ring-shaped pattern that can be either lighter or darker in color. These rings can be anywhere from half a centimeter to 5 centimeters in size and can appear on your butt, arms, and legs. The good news is that GIGA is not usually painful but can be itchy. The bad news is that it can take a long time to go away, and there is no specific treatment that works for everyone. Doctors have tried to use different medications, such as anti-malarials, retinoids, and even steroids to treat GIGA. The best treatment plan will vary from person to person. If you notice ring-shaped rashes on your skin, you may need a treatment plan that reduces your blood sugar. Have you ever heard of skin tags? These little skin flaps can pop up on your neck, underarms, or even around your eyes and are small, benign growths of skin. They're typically found in areas where skin rubs against skin. Another name for this condition is acrocortins. Up to 75% of those with diabetes have skin tags. They are common among people who are overweight and of older age, as well as women. They are relatively harmless but can be annoying or make you feel self-conscious. Science suggests that the number of skin tags on an individual may indicate their risk of developing diabetes or insulin resistance. While skin tags are not harmful, you can eliminate them for cosmetic reasons by excision or cryotherapy. Lastly, diabetes can also cause scleroderma-like skin changes. Studies have estimated that 10–50% of patients with diabetes have this condition. Scleroderma-like skin changes are more common in those with type 1 diabetes and those with long-standing diseases. The appearance of scleroderma-like skin changes includes painless, hard, and thickened skin. These changes occur symmetrically and bilaterally, around and in between the fingers. In more severe cases, this disease may extend centrally from the hands to the arms or back. The thickening of the skin is due to increased collagen, caused by reactions associated with advanced glycosylation end products or a buildup of sugar alcohols in the topmost layer of the skin. These changes are also associated with an increased risk of developing nephropathy and retinopathy in those with type 1 diabetes. The treatment options for scleroderma-like skin changes are limited. Tight blood sugar control can lead to the narrowing of the thickened skin. Lowering sugar levels can also trigger aldose reductase inhibitors to help limit the increase of sugar alcohol. Physical therapy can also help to maintain and improve joint mobility if you experience restricted ranges of motion. Remember, the best way to prevent all these skin changes from getting worse is to manage diabetes. and its complications through lifestyle. Changes such as eating a healthy diet, exercising regularly, and maintaining a healthy weight. That's why we have a couple of video options to help you stay healthy. Check out 8 healthy fruits you should be eating and 8 you shouldn't. Or which is better for your weight loss, cardio or weights. Go ahead, click one, or better yet, watch both and learn about different ways to stay fit. Do you have any of the skin conditions mentioned above? Let us know in the comments below.